some kind of stock taking. So, I mean, where we are in terms of COVID situation.
I think the update through COVID is, for me, there's so many separate issues. I think there is a huge issue for me around public perception and understanding, and that is linked to some extent with politics. You can't avoid it. I don't want to be political in this podcast in a direct way, but the mask wearing scenario, the anti-vaccine, the fact it skews slightly to right-wing views where they don't trust things. You do find it in other areas as well, but that's part of it. So there's a public perception. There's the direct effect of COVID and the tools that we have to deal with it. And then I think probably if you try and put into that a third area, it's kind of the indirect effects of COVID, I guess, if I'm trying to make a grouping. And for that, I would talk about what long COVID has done, what's happening with waiting lists, what's happening with the functioning of the health service in this country. So within those contexts, things cross over, and within higher education, they cross over. Where are we? We're seeing basically a relatively steady state in the population of infections. They've been falling recently. If you look at the figures in Scotland, so we're talking in August 2022, really the only significant uptick that appears to be is around Edinburgh, which might be something you'd expect with the International Festival on. People in closer proximity and in venues, you can think about ventilation from all parts of the world. So that's the first thing to say. In hospitals, there doesn't seem to be intense pressure on the ICU units, on some of the facilities that were taking up so much attention during the waves of the COVID pandemic, but there have been deaths. The Guardian reported recently more deaths this summer than last summer, and there might be various reasons for that. We also have it potentially circulating in healthcare settings, people arriving in hospital and people becoming infected because, again, you've got more movement of people between different departments. And there is still that knock-on effect with staff absences, with long-term COVID, with people who've been lost from the service, some of them sadly because they've actually, there might be mortalities within NHS staff. We know that was that was skewed towards certain socioeconomic and racial groups at the start of the pandemic. So all those things are impacting on the health service. So at the moment, I think you're in basically a position where the health service is functioning. It's under a lot of pressure for other surfaces, and the infection rate looks relatively stable. If you want to look towards the future, there are variants coming out, and some of them with immune escape, but none of them seem really to have the high transmissibility, the immune escape, and so far no clear evidence on high mortality. So there's something that's one circulating in India, and they've gone down a separate lineage, which is down the Omicron lineage. What is interesting about them is they've accumulated lots of changes, and again, we'll come back to the vaccination policy for this autumn, and some of them might actually be diverged enough that they'll escape even the bivalent vaccine, which I'll come to. So you want me to summarize, we're in a state where things work. We still have from the Scottish Government policies around using masks and being careful. And I would still advocate that in enclosed spaces. I would still use them. There's an emphasis on ventilation, which is an interesting issue in itself, which we can discuss further in higher education. And there's on the horizon a bivalent vaccination policy, which will come in. So we seem to have something that's controlled. We have no immediate threats that I have seen on the data from variants, but there are variants out there that could suddenly cause a problem, but they don't seem to be getting all the features to become another significant wave. As far as the death rate's concerned, it's hard to make sense of the death rate. It might well be that what you're looking at now are people who might have been shielded through previous rounds who've actually become infected or become vulnerable. It might be a knock-on of other conditions, but it is something that probably needs more examination. Long COVID, still a lot to be done. In Tayside, we have support, and in various NHS boards, they've got specialist support clinics. So we're quite good in Dundee for that we have access to it. You can be referred through your GP. There are treatments that people are looking at, from anticoagulants, from even vaccination seems to be helping. There's the extreme one is filtering blood because of microclots and the role of it. It seems to be getting a little bit better, a little bit easier to understand, but we still don't fully know the full long-term implications. So I guess you asked me where we are.
Yeah.
I think we're okay. We probably have the tools for a safe winter, but we probably will still have significant amounts of COVID going around.
No, because I mean, one thing I noticed, I mean, because I suffer from OCD. I spoke to you about that.
Yeah.
I'm kind of always anxious about, what's going on around me. So recently I started going to cafe, inside the cafe, and I did not feel that much anxious about that, because it looks like, I mean, almost looks like it's the beginning of the end. So kind of you're moving forward now from that, the COVID setting. Sometimes I feel that it's just no longer there in your brain anymore. You go to a Tesco or in a big shopping mall, and you are not worried about that. No one is actually wearing mask anymore, looks like. I think we talked about these things quite a lot about the wearing mask. Perhaps this would be the norm for future. I'm now more skeptical that people will actually know.
I think one of those issues around mask use is that idea that it has been associated as a badge in some way. That people are actually using masks to identify a political belief or a freedom belief. And I've encountered anti-vaxxers outside the dental practice where I had to attend to check for a cracked tooth, and spouting all the material they've read on the web about the increased lung infections or respiratory infections. Well, the point is respiratory infections have gone up because there's been a respiratory virus that's been circulating in the population, amongst other things, and claiming their human rights and how badly they're treated. So I think what happened with masks is politicians exploited them. I mean, we saw that in the House of Commons, where one party would not wear masks and other parties would, and the term muzzle and individual freedom and all these things. This is a curious thing for me for a public health policy. So I think that mask use is quite interesting. I'm quite aggressive, as is my PhD student, actually, and we wear masks aggressively. Almost to actually make a state. We walk 10 yards and take one off and go into the till to the other. I think, especially the type 2 masks, the mask technology that's improved, I think the N95s, 95 filtration, I think they have a very effective use in control of viral diseases and beyond COVID. But I totally agree with you. I don't think most people are taking that on board at all or doing it. And I have to be honest, if I've forgotten it and I've gone into a shop, I don't worry too much. By the same token, I work in an NHS campus where it's required because it's a dental school and it is as it is in Ninewells. I'm also completely aware that it's going around because the technician who came in to fix some equipment this week in the dental school on the 10th floor on Monday subsequently tested positive, and we've been told from an external company. So somebody's come through with it. It doesn't mean that I would have caught it, or whether I would have been resistant. I don't know what the impact would have been, but and my neighbour had COVID for I think it was the second time, but he has also been vaccinated, and he had it quite bad and long COVID, and this was after presumably Omicron as well. And he was unwell for 1 or 2 days. So what you said about mask use, totally agree with you. It seems to drop out and gone back to normal. I think politicians haven't been positive. The messaging hasn't been positive on it. It's all been negative. I think there's been quite interesting stuff about how effective they've been. And again, I would say if you want to look at this, look at Southeast Asia. I mean, it's quite remarkable how well tolerated it is. And as to my knowledge, there's none of the political
mm,
baggage associated with mask wearing.
mm, mm. No, it's like, I mean, almost it looks like, the way the climate change politics, I mean, you can see like every now and then they brought up this kind of idea that, oh, 1,200 scientists now say that you don't have to worry about climate change. And then you do a bit of more research on those 1,200 scientists, you'll find that they're actually not scientists. They're like, astrophysicists, or like, I don't know, like some.
I find this curious thing that on one thing they tell you how scientists cause problems and don't trust the experts, or they had too much power. And then if they find a scientist who agrees with them, they say that all scientists have shown this, that, and the other. And I think, and like I said to you, I think you have to develop the scientists from the science, and that's really the thing that you have to do. If the science is well done, it can indicate a likely outcome, a likely set of information. What it does is it proves within the parameters you set that this seems the best explanation to fit all the facts. But it's constantly shifting and moving. Some things have stayed around for years, gravity, things like that. But again, all those equations and all that sort of complex astrophysics, they start to alter that when they get near black holes or things like that. So things have evolved and changed. And it's very difficult to predict what was happening. So, yeah, I mean, when you say about this idea about the science behind it, masks are quite effective at limiting spread. And I don't understand it. It's the cheapest intervention and the most effective intervention. I really do not get the politics of masks, because vaccination, everything else, public health measures, ventilation costs money. Lockdowns, I just don't understand that you're supposed to have this. And again, my politics isn't, as you know, very radical, but it shows through to me. But you have this capitalist argument, and here you have this simple, effective healthcare measure that would reduce the burden and allow you to do all the things, because somehow it's a symbol of personal freedom, which they made it into, right? They jumped on it. They screwed themselves up over it. Suddenly, that's the issue. And they, mask use, I don't really understand, like I said to you.
No, I'm like following this, like, Tory party's leadership contest. Rishi Sunak was saying yesterday that, oh, I mean, the things we have done during COVID, perhaps we should have done it different way. Like, what does it mean?
Undoubtedly, we would have. I think we would have locked down sooner, and then you wouldn't have locked down as much. Again, like I said to you, you could have kept masks. You might have not eaten out to help out, but anyway, that's by the by.
But I think Sunak's position is like, I mean, we should have opened up everything from the very beginning, so rather than
Well, but I think the argument they make is that look at the state of the health service and the economy and everything that's happened, and the people who are dying because they didn't get the cancer screening and the cancer treatment, and the people who have mental health issues and this, that, and the other. And what they take against that is you can't really balance the unknowable, but against that you would have to have dealt with a potential collapse of the NHS anyway. You would have maybe lost senior surgeons and doctors, or people who couldn't be vaccinated. You certainly would have had mental health issues from people who were bereaved on an even larger scale, and you would have the economic knock-on effect of that workforce disappearing and people with specialist skills disappearing. So you can't balance it. That's the problem. But you can sell a narrative, a simple narrative. And I think the other thing which is I find very hard to deal with is how I think there's an empowerment by feeling that either you've been badly done by, or you know better than other people, that, they missed the obvious, they've made it too complicated. It makes you feel more important that you've understood it. There was a lovely study that was published where they looked at the amount of objective knowledge you had about the subject and the amount of opinions that were had, incorrect. And obviously, the less objective knowledge you had, the more likely you would take up extreme positions on an opinion. The more knowledge you had, And the less extreme, the more you would move to the consensus as you move to it. So you can argue that's skewed because of what you're reading. But what it shows is the less you understand, the easier it is to assume a position. And people don't want complexity. We've had this discussion before.
Yeah.
You can't guarantee what's going to happen about things. What you do is a shifting level of probability. I said to you in an earlier podcast, there were mistakes. And one of the scientific mistakes in this country was it was treated based upon the influenza plan rather than looking at SARS when it was a SARS virus. And that's very obvious, but people get fixed on what they think it should be and what they should know and what they should do about information. And that's where I go back to education and what you do and what I do, which is trying to constantly check your understanding and look at your sources, challenge your opinions, use hypotheses to actually see that actually what you're doing is not necessarily correct, but is the best course available based upon objective information.
I mean, one thing I noticed also that, the social media, the role of social media, I mean, I think the people who are anti-science or anti-climate change thing, I mean, they're very vocal on the social media. And then, if you put anything, any kind of, article, science-based article, you can see that, responses by these very, very angry people that, they're trying to destroy our, business, our lives, and things like that. Are there any data on that? Like how many people actually know? So what's the divide? The way we did like Brexit, 52%, 48%. I mean, this is quite frightening because if that things come back again with full force, then I mean, how to deal with this divided society?
But that is, the paper's quite good on that. Like I said, I'll try and find the reference and send it to you. A friend of mine, somehow he got hold of it and I picked it up through social media. But that idea about how you base your opinions on the level of knowledge you have of a subject, it was quite noticeable from vaccines to everything going through. I think that there's a couple of things, isn't there? I mean, people like certainty. I said that thing about empowering, but if you know something, if you feel something, and even an identity tells you something about yourself, what you're expected you to do. And then I guess there's the echo chamber thing that the social media allows to echo some of those actual ideas and philosophies. I mean, I think culturally we had that. I think what you had was, whether it was a religious or a racial or a socioeconomic group or class, it was easier to hang together because people shared the same values, often through shared experiences and a shared narrative, but that sense of identity. And once you start to mix that up, it starts to challenge things and look at things in different ways. And I think social media still allows those echo chambers to exist, to find somebody who has the same views as you or something you want to believe. And they often, simplistic views offer certainty. I mean, what we offer is uncertainty. I always think that, and again, I'm not being anti-religious, but one of the comforting things about religion is it offers you a degree of certainty and a model that works. A more humanist or scientific, but it's more uncertainty. Okay, you've got agnostics in the middle, somewhere in between. But social media, I think, just amplifies that. And I think maybe the worrying thing is it allows more extreme groups of people to get together, and we've seen that even with child abuse. I always think about the fact that a particular, doesn't know what to avoid the word fetish, but a particular thing you're interested in, again, you can find that resonation. Now, you can say that might help some people, but also when there are extremes of behavior, that allows them to actually feel it's acceptable, part of a group. So I don't think there's a good or bad here. I do feel that about technology, whether you go back to the atom bomb or whatever. It's about us as humans understanding it and being aware of it, like with advertising. It's only when we're not aware of it. And I go back to, I think I've said several times, it's about education. It's about you understanding what's happening to you and never being fixed in a position, being able to change and look at it. I mean, again, we're going slightly skewed with politics, but the gender politics stuff and the trans issue stuff, I'm still learning so much that I don't understand about some of the elements and some of the language and the use of things and pronouns.
Mm.
And that I was totally oblivious to 5-10 years ago. So,
But at the same time, you're not rushing to have a position that, okay, no, no. So you are still trying to learn more and more because you really want to make sure that, so that no one is hurt with your comments, with your, understanding about this. I mean, what you are saying, the complex issues. I mean, the one thing I really noticed, like while doing this podcast thing, because I have to upload them on the YouTube, the people are saying that social media are irresponsible. They don't, filter things. They don't, like check those things. I mean, one thing I noticed that they actually do check. It's a quite rigorous process. For example, like I did a podcast on China, so with my colleague about, recently, like US's House speaker went to Taiwan, and that created a bit of, political conundrum between, two superpowers. It's a really good academic talk. And then when I try to upload it on YouTube says that, no, you cannot upload it now. And then, and it gives me option, you can appeal it. and the reason they said that this podcast can influence US election. I mean, what to do with this? I mean, so who's deciding that how this will affect US's election? They're going through, this primary and, in like November. I mean,
yeah. I think what you highlighted is everything that you want, the freedom for people to express things without the censorship. And then without the censorship, you also have to accept the echo chambers and the extreme views that come through. And how do you deal with that? And I don't know that there is an answer. It's like you said, I keep questioning and looking at that's a luxury I can do as an academic. If you're a business person, do you have to sell that or buy that or do that? If you're a clinician, do you operate? Don't you operate? Do you give him this drug? Don't you give it that drug? And I think a lot of people's experience is making hard and fast and quick decisions. My son's quite good at football and I see him playing football. And one of the things that I think is quite creative about him is he's making a decision instantaneously at times under pressure, to the best of his knowledge, and doing it faster than other people. If you stood around and thought, what's the right thing to do or wrong thing to do in this situation, which have been things that he's at semi-professional clubs and academies, they try and coach at times. I don't think there is enough time to do that. You know what I mean? You can't overthink it. And so I think that's a juxtaposition between people in real life. They can't sit around and think what to do if somebody's bleeding out. Should I do this drug or that? You talk to medics, then if they can't get the diagnostics, if they've got no other way of doing it, they go with the most likely because they don't have time to explore all the other conditions and information they have. Right? So to buy time, or they deal with the immediate things. I mean, they have this for emergency. It's A, B, C, D. I'm not sure. I don't think it is E. I think A's airways, B's breathing, C's cardiac. D is neuro. Is it confusion or neuro? There's one for cure, and the other one is E is exposure, looking for a cut on it or whatever. But D is there's the word is associated with the person not being conscious or unconscious, that sort of thing, right? So they have an A, B, C, D, E, which they do on a thing. So what we're talking about, I think, when you talk about your social media, is you have this issue where you're trying to bring something to open to a discussion. And to some extent, how sensorial it is, I don't know, but you're being censored. But at the same time, we criticize the people who can publish all these lies and they can be followed and checked. And, ultimately, it's about creating a rounded individual. And I do think that's, every time I go through this and I listen to, we have friends in the union who are more left-wing than me and things like that. But what I quite like is that there's a discussion and there's a way to find things and discover through that discussion. And it's education is the only thing I think you can do. You'll be skewed by personal experience, but if you're open to being educated and you're open to understanding, and empathy is an underused word. right? I mean, I wear a mask partly because I might infect somebody who's immunocompromised,
mm, mm.
you know.
And I think most of the universities will be starting in 2-3 weeks time. And it looks like, what you are saying, the Scottish government is still waiting to publish their, plan. Universities is still planning. There are lots of unknowns
Yeah,
here.
I think that I do think politics is partly driven by the media, that they get criticised, like I said, the things that come on. But I think there's gentle suggestions from the Scottish government. I don't think gentle suggestions work. That's certainly been my experience through health and safety work. I think the government has to give a directive, and the union in Scotland has been brilliant and the Scottish government has been brilliant in listening to unions as well as employers. So I think that's been effective. I think they miss opportunities. They've said they miss masks. Ventilation seems to be something that I wasn't a priority for me to begin with, and looking at it basically because we couldn't address it, and masks were there and you could get them off the shelf and they worked. But looking at venues and capping venues, what's been interesting from the limited amount of data I've seen from our CO2, which we've done in our department, and every department's got it slightly different. And again, I think the university missed an opportunity to coordinate that, although they'll coordinate it and they could have acted quicker. And the Scottish government supplied the CO2 monitors, so that's also something we should be happy about. But I began to be aware about, the effect on learning of high CO2 levels. That was quite interesting because the initial HEC guidance was 800 parts per million, then it moved to 1,400 parts per million. You start to see in a lot of the papers they talk about cognitive changes above 600, but definitely above 800, and trying to keep it below 1,000. And we looked at one of our rooms. I've only got one set of data, so this is very limited to anybody listening to this. So it's just very superficial and an immediate response. So it doesn't have a greater context that needs checking. But one room, we got to the 40 people. I think it was maximum capacity 50 in that room. And over the hour, it got up to 1,000. So that didn't breach the guidelines. And it also wasn't a straight line. It then went down a little bit. We don't know if a window was opened or stuff, but it built to 1,000. But it would have had an effect on learning. And I just wonder about that, about venues we've been teaching in, which have been poorly ventilated. And there's a knock-on effect with climate change, because one of the things with climate change is houses are being built with better and better ventilation. Better and better insulation, which has impacted on ventilation. So I do think it's something that is it's inconvenient for universities because it requires expensive money. It's inconvenience for estates departments, partly because they're overstretched. They don't have the people to assign to go around looking at it and checking it. Fair enough. They don't get the money. They put in that we need more staff to ensure safety and this, that, and the other. I'm not unsympathetic to them saying, oh, we can do this, but we can't do that. But ventilation's been something we've missed out. So we're going into the term. Vaccination policy, again, for me, mask use and vaccination policy, I would have just kept positive messaging. But there seems to be a slight fear about that. We will need vaccination probably because we don't know how long immunity lasts. The bivalent looks good for helping. It certainly doesn't look like it'll do any harm. But the other countries might be having ones that will protect against even some of the Omicron B5 and the other variants beyond, because they might have bought theirs a little bit later. So one of those things about a rush to buy vaccines is sometimes you can buy something a bit early that might not be. So it's always a trade-off. It doesn't mean it's correct. And the only other thing I'd say on government policy is I think the Scottish government trying to keep the whole vaccine programme going by the company in Glasgow, I think is a good idea, because whole vaccines have other implications where they might help with protection. But yeah, so we're going into the year knowing that we can address ventilation, and we've done it through student numbers, and CO2 monitors are going in. Mask use would be easy, and then positive messaging on vaccination would be really, really good.
One of my worries is like, if university goes back to that, 200 students classroom, those like big lecture theaters, that worries me, because I mean, if that happens very soon, that okay, the first lecture will be on the 26th of September in like, this building with like 350 students.
So then it's not a very comforting thing, especially for somebody like you, but then it does become a sort of a gambling, a percentage thing. So you have to think how protected the population is and how likely it is. So you need to know roughly the prevalence of the virus. And then you have to know the relative susceptibility. So vaccination's been really good, but also has been the virus naturally infecting people. You know, I got infected about 3 or 4 weeks after my booster, my third dose. It would have been the third dose, wouldn't it, the way it was done? And that was probably ideal booster from Omicron to some extent. So there will be people in the population who are protected and whose immunity might have gotten through the summer and beyond. So if you have a population where there's less virus, so there should be less people spreading in the room. If the room has good ventilation and a limited number of people, again, there's less chance of virus particles. But then again, that's an if, and we know certain rooms don't have passive ventilation, certain rooms have HEPA filters, whatever. If the students were masked, I would have that over ventilation any day of the week. But that's not something we can come in. If you can walk in with a mask, so as you move through any spaces which people have been in proximity with, they might have shedded into, where it hasn't got time to settle, and you move to a podium that is a good distance away. I would like it more than 2 meters, but at least 2 meters away. And you've been vaccinated and protected, you've probably got a good chance of protection. But I will put mask use into that. I would put mask use in moving into the space and moving out of the space. I would also take it away from close practicals or tutorials where you're going up or talking to the students. And if you're asking the students to talk, because talking, coughing, all those things play into it, right? So if you've got the large lecture theatre, if you're at the front and if the prevalence is low in the population, you're probably okay. Your biggest risk is moving through those groups of people in those communal spaces, the corridors to get there, the corridors to leave, because you're talking, because you're generating the aerosol. But two-way tutorials, I think, do them outside in a tent if you can. No, seriously, I would have. I would have put outdoor spaces, you know, artificial pavilions and stuff like that for the provision if people wanted to do it. I know you're cold, but you can do it, right?
We don't know the expiry date of this coronavirus, but we have to just carry on like this. Sometimes, you know, the brain says that no, you know, got to, you know, a point where it says that, okay, that's it. We are not going back.
Oh, yeah, they like that and they think it's all gone away, which it hasn't and stuff. I only say it's manageable in the sense that the number of people dying, which are high, and the number are relatively controllable. The problem is that your A&E crisis because of staffing and hospitals and people, your health service, these people have been working like crazy. I'm not saying other generations haven't had that trauma, but I'm just saying there's so many knock-on effects. And then you've got the delayed cancer care, you've got all the other things from seeing GPs. My son is being referred to a cardiologist. It's just for a checkup, but again, that's taking longer and things like that. So all those other things, while the COVID, the wider impact on society, and that goes beyond the economy, is still there. And what I worry about is if we don't take care, if we don't prevent preventable infections by wearing masks and having some degree of control, that we're just going to put more pressure on the NHS. And that is something that I think isn't directly, very directly linked to COVID, but I think that's what we should do responsibly, especially as a university with a medical school.
One like final question can be, do you know this like new booster they're planning to do?
Yeah, the bivalent one,
So like people, you know, talk about certain brands are good, certain brands are not good. Do you think that government is doing a bit of compromise because, you know, this brand is cheaper? I mean, so.
Well, it's a different type. The point is vaccination is a catch-all for certain people, but what you vaccinate with and how you vaccinate. So one of the big successes of the pandemic has been nucleic acid or particularly RNA vaccines and their effectiveness. And that's what they've gone to, because there's a speed at which you can change the constituents and that you can deliver it. there are potential disadvantages. People hadn't done it on population wise, but it seems to be a particularly effective mechanism. So what they did was they secured one that could be adapted, and it's bivalent. So I think they've actually done the right thing and gone to the choice. But the mistake is partly to put all their eggs in one basket, because the live vaccine is still interesting. I'm not asking to invest a lot of money, just keep it ticking away that there's research done on it. And I think you'll also see, like other countries has gone, this is bivalent, this has got two forms. It's got something like the original spike, and then it's got something like the Omicron spike, which works quite well. But they're also looking at things which might be even more universal, that give antibodies to it. So no, I think they did the logical thing and the appropriate thing. The problem is the virus can be changing quicker than the vaccines can, even though it's very, very quick to adapt and change it within effectively 6 to 9 months, which is amazing, and deliver it. And that's why you would limit spread. And that's why I would limit you getting infected or somebody healthy, if it's a simple way of doing it. If wearing a mask in public during the winter is a simple way of doing it, if having effective ventilation, because it's less chance to mutate. Okay, you can say it's going to happen anyway. Yeah, probably. But the less people have it, the less chance. So it seems to be moving in a way, and it might be moving into a way that we have a circulating coronavirus with seasonal vaccination, and that might be enough. And that's what you would guess from history. But the problem is it's not an absolute, and it's a new type of virus, but it looks like it's heading that way. But yes, I think this autumn will be challenging by the looks of things. The good thing is there's not, the variants so far that were scary even 3 or 4 weeks ago don't look too bad. But then there are weird things happening in India and Denmark, which have to play out a little bit. Denmark, there's a hospitalization rate that's gone up, which is not completely, as I looked at the figures a week ago, wasn't completely clear why that was happening.
So your advice will be, if it's offered by NHS, take it.
Yeah. I see no reason why not. There seems to be good efficacy for it. And the problem is that your immunity wanes. The other thing I would say, which is also counterintuitive, and even to me as a microbiologist, it was something I had to read twice, but you seem to get a lower level of immunity from infection than you do from the vaccine. And it's basically because it's concentrating the amount of that spike protein very effectively. And that seems particularly good with these RNA viruses. You get good antibody responses. And so, yes, I would take it, because you don't know when it will wane. And if you half and half, take it for you protecting it and not spreading it to somebody who can't take it, who's immunocompromised. I would also say always have a mask with you. And if anybody's coughing, or you're going to a doctor's surgery, and even if you're in the hospital, have a good N95. They're there, they're commercially available, even some you can wash. And don't be scared, and don't feel you're an idiot wearing it. I mean, I'm not saying wear it with pride, but you know.
Thank you, David.
No, it's a pleasure. Thank you for asking me. And it's always nice to talk to you. And if it's something for your podcast, that's great.
Yeah, because I mean, these are the wise men talking, and I think this is important.
Well, I think it's important to give a rounded debate. And I think what you have to say is you take the opinion and then you read for yourself and check out those other things. And the Scottish government advice to do these things is out there. There's enough there. You can look at the World Health Organization. You can look at the traveling tabby, I've said to you before, is a Scottish thing that starts to see what's going. Don't freak out, but do know that N95 masks are proving really, really quite effective if you can tolerate them. And if somebody gives you abuse for them, well, I would ignore it. If you can't wear one, you can't wear one. That's fine.
Thank you.
No problem.
Okay. You take care.
Okay.
Okay.
Bye.
Bye-bye. Bye.